Good afternoon, dear students. Welcome to the seminar devoted to assessment of the exercise tolerance in children with cardiovascular disorders. An urgent problem of our time is early detection, prevention, and treatment of cardiovascular diseases. Studies of the adaptive capacity of the body and based on changes in the cardiovascular system and autonomic nervous system response to exercise. Tests for exercise intolerance normally involve performing of the some physical exercise. Changes of autonomic tone, pumping action of skeletal muscle, increasing of ventilation due to increasing of contractility, arterial pressure, heart rates, and decreases of vascular resistance lead to increasing of stroke volume and cardiac output. Cardiac exercise testing is a commonly performed non-invasive method to evaluate the cardiac symptoms and assess functional capacity in children and can be considered as safe. Reasons for stress testing are evaluate specific signs of symptoms that induced by exercise, assess or identify abnormal response to exercise in children with cardiac, pulmonary, and other diseases. Access to specific medical or surgery treatment, assess of functional capacity for athletics, establish baseline data for cardiac rehabilitation. American College of Cardiology and American Heart Association include report a recommendation for exercise testing by degrees. Class 1 include condition in which there are evidences that the procedure performance is acceptable and effective. Class 2 condition in what evident conflict on procedures, acceptance, or effectiveness. Class 3 condition in which there are evidences and that the procedure not accepted neither effective and in some cases it may be even harmful. Class 1 include evaluation of exercise capacity in children, congenital cardiomyopathies, uh, and valvular acquired disease or myocardial disease. Evaluation of children with complaints of thoracic pain due to angina. Follow up the heart patient response to exercise. Evaluation of symptoms related to exercise in young athletics. Class 2A are evaluation of the response to medical and surgical treatment or in children with tachyarrhythmias. Follow up of the acquired or congenital valve uh, pathology. Evaluation of the rhythm during exercise in patient with exercise-induced arrhythmia. As one of evaluation of children with family history of sudden death in during exercise, follow-up of cardiac abnormalities with late coronary possibilities such as the Kawasaki disease and systemic lupus erythematosus. Follow-up of the cardiac frequency response and the development of ventricular arrhythmia in children and adolescents with congenital atrioventricular obstruction. Quantification of cardiac frequency response during exercise in children and adolescents treated with beta blockers. Uh, Measures of shortening or prolongation response of the QT interval corrected in exercise and diagnostic of QT prolonged syndrome. Evaluation of the blood pressure uh, and follow up with exercise tolerance of patients with compensated or submitted to palliative surgery of cyanotic congenital heart defect. Class 3 include evaluation before the participation in sport activity in healthy children, routine investigation on typically non-angina, thoracic pain, and evaluation of atrial and ventricular extrasystoles in children. So, general contraindication for stress functional test are severe general condition, severe protein energy, malnutrition, severe obesity, uh, respiratory failure, intracranial hypertension, mental disorders, epilepsy, vascular malformation, blood disorders, metabolic disorders, incomplete compensation of chronic pathology. Cardiovascular contraindication for stress testing, um, uncontrolled cardiac arrhythmias, symptomatic severe aortic stenosis, a controlled symptomatic heart failure, acute myocarditis, pericarditis, moderate stenosis, valvular heart diseases, electrolyte abnormalities, severe arterial hypertension, hypertrophic cardiomyopathy, mental or physical impairment leading to inability to exercise adequately, and high degree interventricular block. The testing room should be large enough to accommodate all the equipment necessary, including emergency equipment. Uh, should be lighted, clean, and well ventilated with temperature and humidity control. The Ruffier test, 6-minute walk test, clinotrostatic test, testing with ECG monitoring, stress echocardiography with Doppler. These are main methods of exercise tolerance testing of children. In order to assess the functionality of the cardiovascular system, a Ruffier test is performed. After 3-5 minutes of rest and sitting position, the heart rates are counted during 15 seconds. It is proposed to perform the load in form of 30 squats with arm outstretched for the 45 seconds. At the end of squats, the heart rates are counted for the 15 seconds and the last 15 seconds of first minute of recovery. Then Ruffier index is calculated by the formula what you see in your monitors. And evaluated results of Ruffier tests such as unsatisfactory, weak, satisfactory, good, and excellent by age of child. The 6-minute walk test is increasingly being used as functional outcome measure of chronic pediatric condition for determination of maximum oxygen consumption, and has also been used to detect exercise tolerance of healthy persons, rheumatic condition, heart failure, chronic obstructive pulmonary disorders, and to predict of hospitalization and mortality. 6-minute walk test is simple and time consuming. The combination of distance travel with time of recovery of heart rate and blood pressure, all of the quantity of functional class of circulatory failure. This makes it possible to increase of assessment which important for determination of effectiveness and treatment and rehabilitation uh, of children with pathology. So this test in arbitrary walking speed, in which the patient is asked to walk as quickly as possible for 6 minutes on the flat surface. At the same time, the distance traveled by the patient in 6 minutes is estimated in meters. The dynamics of the patient clinical condition, heart rate, blood pressure at the first minute of recovery monitored. So here you can see classification by functional classes um, um, on symptoms at passing of a certain distance. First functional class, patients are able to walk in 6 minutes from 526 to 426 to 550 meters, and second functional class from 300 to 425 meters. Third functional class from 150 to 300 meters, and fourth class less than 150 meters. In order to study the nature and type of autonomic reactivity, the clinotrostatic test is performed. Vegetative maintenance of activity, a measure for vegetative provision of various forms of activity, mental, emotional, physical, of the body and systemic systems during the process of performing the load. Blood pressure and pulse were measured in horizontal position after 10 minutes of the rest, followed by a measurement in a vertical position for 1 minute of standing. Variants of the reaction are separated as normal, hypersympathicotonic, hyperdiastolic, and asympathicotonic. In the normal variant, there is an increase in heart rate by 20 to 40%. Blood pressure um, increase by 5 to 20 millimeters. For hypersympathicotonic variant, an increase of blood pressure and heart rate is registered uh, excessive. Uh, and this option show hyperadaptation. The hyperdiastolic variant is determined at the isolated excessive increase of diastolic blood pressure, um, and it's the most maladaptive type of reaction. The asympathicotonic variant is characterized by the absence of the changes or decrease in pressure or normal or increased heart rates. Treadmill test and bicycle test should be done like exercise testing with ECG monitoring. Treadmill test in staying position, bicycle test in sitting position. In bicycle named veloergometer. The treadmill test is employed for purpose endurance time is used as an index of exercise capacity. Treadmill exercise testing is possible in children from the age of 3 years old. Stress test protocols differ in speed of treadmill angle, step duration, changes in working parameters. There are a number of protocols uh, what, for different categories of patient. Heart rate, saturation of oxygen, blood pressure should be registered before and after each test. Maximum and maximal speed, maximum load step supported by the patient, the pace of step, recovery time should be analyzed too. Bicycle test may also be used. For these protocols, the peak work rate rather than endurance time is used as the index of exercise capacity. Exercise testing on bicycle possible to do more than 6 years old patients. Two types of stationary bicycles are used for tests: mechanically braked and electronically braked. Bicycle testing is portable and less expensive than treadmill test, and accurate determination of the workload is easily. In general, the total exercise duration in bicycle and treadmill test should be kept to 6 to 12 minutes in children to avoid the fatigue and lack of attention and motivation. Heart rate, saturation of oxygen, blood pressure should be registered before, during, and after test. Distance, pedaling rate, average speed at the distance, and recovery time should be analyzed. Detection of highest tolerable load, at which of one or more signs appear, considered as indication of the stopping of the test. PVC test possible to determine of physical performance based on the fact of relationship between the power of the work performed and the heart rate, which within the limit corresponds to the aerobic type of metabolic process in the myocardium. Its two-stage load is carried out with the calculation of physical performance by formulas. Exercise stress cardiography can be used in children more than 8 years old to perform an exercise test. Stress echocardiography can be exercise and pharmacological, but pharmacologicals we use rare in pediatric cardiology. Exercise is more physiologic stressor, increase heart rate, contractile function, and blood pressure. So often, early myocardial damage is difficult to detect at rest as the heart muscles use different compensatory mechanisms to maintain pumping function. In conjunction with myocardial perfusion and imaging or stress echocardiography, it can also detect evidence of myocardial ischemia during exercises. Doppler and strain technology with stress imaging allow a more quantitative analysis of systolic and diastolic function. Abnormal diastolic function changes may occur before systolic wall motion abnormalities. Diastolic parameters can be recorded near peak exercise or after wall motion has been successful. In this slide, you can see criteria of positive stress echocardiography. The maximum ejection fraction of the left ventricle near 35%. An increase of ejection fraction of the left ventricle under load by less than 5%. The appearance of violation of contractility in left ventricle, and appearance of violation of local contractility of left ventricle during exercise. Heart rate less than 120 beats per minute. So we can conclude that a number of physiological changes accompany the facilitate the accommodation of the circulatory cardiovascular system to the hemodynamic demands of exercise. Reducing of exercise tolerance forward hemodynamic, metabolic, energetic changes, and can be predictor of any vascular catastrophe in patients. Uh, Thank you for attention. Goodbye.